Walk us through this. I mean, really, her biggest concern was the neck, and you focused on that with this procedure.
Absolutely. Well, first I'd like to say I love this procedure because the patient satisfaction rate is so high and the results last a long time. The American Society of Plastic Surgeons recently released a study from 2017 where the neck lift was actually number 9 on the list, where previously it just wasn't even close to making the top 10. So it's definitely on the rise, as you know. To do something. We've had Botox and fillers, you know, for our face, but really the telltale sign of aging starts in your neck. So what I did for Lisa is the procedure only lasts about 3 hours. We make a few incisions here. I go right in front of the earlobe here and back behind the ear into her hairline like this. And I do that on both sides. We elevate the skin flap from the underlying tissues all the way to the midline. And then I just make a small little incision right underneath the chin. And that way I can dissect down and remove the fat under direct visualization.
And Angela, while you're there, just make a few dots to show the difference between an isolated neck lift and if you continued that and did a full facelift.
So the full facelift would actually extend all the way up in front of the ear into the beginning of the hairline usually, maybe even all the way into the hairline. So this is a very limited incision.
And some people say, I only want this, doc. I don't want anything in here. Typically, we do all of it, but every patient is different. Try to tailor the operation to what they want.
Absolutely. And one other thing I did for Lisa is once you remove the fat, and as we continue to age, the muscles in the neck start to split apart here. And so what I did was take some sutures and bring them to the midline this way, all the way down, almost like a corset of tissue towards the midline. And what that does is that will increase the angle between the chin and the neck, which is a sign of youthfulness. It makes it more of a right angle versus a loose, droopy neck.
Yes.
Well, Lisa, you look wonderful. You look great. Dr. Champion, thanks so much for sharing with us. And
good job.
happy patient is what matters most.